Today we shall review at least 150 questions in spite of the power will come another half an hour it will take. So we invite our online students Brahmaramba, Priya, Apurva, Jyoti and the students in Vizag etc. Lot of students have gone to take their PGA exam which is happening today. So today only no PGI and on Wednesday evening we will have a review discussion on the recalled questions of PGI the way we have done for the AIMS last week and we will give you can have that AIMS video on the YouTube. Now doctor, female breast typically lies on which rib to which rib? What is your answer doctor? Propose some good answer. You like to say second to 5, 7, okay. Then what is the true statement in this, in your opinion? You like to say C? That's good. So it has the suspensory ligaments. Very good. Priya is answering it as C. There is ligaments of Cooper, which are the major fibrous strands, which are the ones which are holding the breast fundamentally. It is between 2nd to 6th rib is a typical location. And if you look at the retromammary space, it is between posterior capsule of the breast and the fascia of the pectoralis major. In fact, after mastectomy, in order to give a silicone implant, typically the surgeons choose the retromammary space is what need to be remembered. Now, with regard to the hip joint relationships, in your opinion, what is a wrong statement? Question number 2. Give some confident answer, doctor. With regard to, you can't put on this fan? No. Huh? Okay. Which is a wrong statement about it? You like to say? B. Obturator externus. Yesterday we discussed, which is the muscle which typically connects the femur and pelvis. Question number 2. Who like to take a adventurous opportunity to answer this question? Other than B. B is one proposal. Priya is guessing it as rectus femoris. But yesterday we discussed, no doctor, pectineus. There is one pectineal line which is there on the femur. Intertubercular line and pectineal line. Pectineus forms the floor of the femoral triangle, is an anterior relationship of the hip joint basically, and it arises from the pectineal line and inserts onto the femoral shaft is what need to be remembered. Now with regard to the chest, what is the true statement about the surface anatomy and a surface landmark of the chest? What is your possible guess? We don't leave you unanswered. Yes, doctor. Out of all this, you like to say? Huh? A, you want to say manubrium overlies the aortic arch? Typically, the body of the sternum overlies the heart at the level of T5 to T8, and that is the reason whenever you are doing cardiac compressions in the CPR, it is the lower end of the sternum which you need to apply the pressure in order to create a mechanical contraction of the heart is what need to be remembered. The manubrium basically overlies the aortic arch at the level of T3 to T4, and the most prominent cervical spinous process is C7 called vertebra prominens. The manubriosternal joint is located at T4 to T5, and xiphisternum typically lies at the level of T9 is what you should not forget. There's a lot of significance for the transpyloric plane in the anatomy. So what is the significance of transpyloric plane? Typically, the transpyloric plane passes through pylorus, pancreatic neck, duodenojejunal flexure and the fundus of gallbladder. And the spinal cord ends at the level of the transpyloric plane, and transpyloric plane is typically located at the level of the L1 is what you have to fundamentally remember. The subcostal plane is at the level of the L3, the lowest point of the costal margin. At the lower border of the 10th costal cartilage on each side is what you have to ultimately remember. Then iliac crest. Typically, where are they located, doctor? At the level of the L4. So, any plane which passes through the iliac crest will typically be the point below the termination of the spinal cord, because the spinal cord terminates at the level of the L1 in adults and L3 in the case of the infants. And it is the landmark for performance of the lumbar puncture is what you need to remember. And the umbilicus, what is the surface landmark, doctor? Between L3, L4 disc is the place where umbilicus will be lying. Then coming to the diaphragm, what is the classical anatomical finding about diaphragm? Voice of America, 8, 10, 12, 3 levels, vena cava, esophageal and aortic level. So, esophageal T8, do you think? Right? No, it is wrong. So, diaphragm typically is attached to the xiphoid is what you have to fundamentally remember. From where does pancreatico-duodenal artery come, doctor? This is very standard question. Gastro-duodenal artery. Now, trigone of the gallbladder, trigone of the bladder is basically formed from where? Urinary bladder. Who like to try and answer? This question is open for you to answer. Tara Chand is also now online. That's good. Please punch your answer, doctor. Question number 7. What is your answer? 777. Yes, doctor. You like to say urogenital sinus? Urogenital sinus. Tara Chand is saying mesonephric duct, which is correct. So, if you look at the epithelium of the bladder, it comes from endoderm. Trigone of the bladder is that absorbed mesonephric duct, which is mesodermal derivative. And serous wall of the bladder is planknopleuric mesoderm, is what you need to remember. This question all of you should answer, otherwise I will be unhappy. Broca's is inferior frontal gyrus is Broca's, superior temporal is Wernicke's is what we have discussed already. That's good. What is the nerve supply of cricothyroid? Having had discussed length and breadth of ENT, this you should answer confidently. Cricothyroid. It is the external laryngeal nerve, but not recurrent laryngeal nerve. Question number 9. Tarachan, Neena is also online. I am very happy to see. Priya is saying external laryngeal, which is correct. This you should answer because we are in the heat of discussion of lower limb. From tomorrow we are starting physiology. The list given in the list is the same listed order we will discuss, unlike anatomy. So, tibial and common peroneal nerve, both of them are supplied which muscle? You like to say biceps? Biceps? Sure. Priya, Tarachan, Neena makes me proud equally by saying biceps. Why? Biceps has a long head which is by tibial nerve, yesterday we discussed. Short head which is by common peroneal nerve is what you need to remember. You want to auscultate the tricuspid valve. What is the best location for the stethoscope? You like to say, it is not to the right of the sternum. Lot of people think wrong. They think that tricuspid is a right-sided valve, hence you have to put stethoscope on the right side. No, sir. It is parasternal left area in the 5th intercostal space. That's good. Tarachan, Priya knows it very well that it is on the left of the sternum. That's good. Meckel's is what? it is a failure of the vitelline duct to close. It's very well known. Then with regard to the esophageal passage through the diaphragm, what are you going to remember? It is the 10th thoracic vertebra, Voice of America, VOA. Then whenever the right ureter is passing, tomorrow you are the obstetrician or gynecologist in charge. So which blood vessel you need to be little worried because it has a close relationship with the right ureter. Give me some confident answer. Priya is proposing question number 14. What is your answer? Yes, doctor. You like to say? Huh? Abdomen we have not yet finished in anatomy, but you can always read it. Tarachan says external iliac. Priya says internal iliac. Internal iliac is too internal. It is the external iliac artery at the pelvic brim. Typically, it is a very important landmark. When the common iliac bifurcates, external iliac forms, it is the one which is in close relationship, anterior surface of the external iliac. Penile erection may, which is a wrong statement out of all this. You like to say? B. Very good. It is the parasympathetic innervation which contributes for the erection, and ejaculation is a sympathetic process is what you need to fundamentally remember. So, lower border of the costodiaphragmatic recess, what is the typical location? So, the pleura, pleurocentesis, pleural effusion tapping. So, you are all experts in that area. So, question number 16. Priya, Nina, what is the full name of Briz? Briz is? Brizanan, Brizdev. Please give your full name. They will enjoy calling you by your name. So tomorrow you also, when you call your patient by name, he is happy man. Remember always. You call, because that shows that if you can't remember the name of your patient, you don't remember about his disease. Taken granted. So if you remember his name means you have remembered his history and you know the diagnosis and what to do for him. That is the kind of assurance patient will feel about you. So please do punch your real names. That's good. So Priya, Nina are proposing B versus C. It is the 10th rib, doctor. 10th rib. So the now I leave all this literature for you to review. Anyway, we will discuss it. The longest vein in the human body is which one? Long saphenous? Nobody want to think IVC? Question number 17. Very good. It is the longest vein, which is the long saphenous vein, is what need to be remembered. Lymphatics of ovary drain into the para-aortic lymph node. This is an interesting question. Entire face is by trigeminal except the angle of jaw, which is innervated by great auricular nerve, is a answer unison. Half Boyer cells are typically located on? In the early pregnancy are the oval cells found in the placenta within the core of the chorionic villus, preventing the transmission of the pathogens from the mother to the fetus, and vertical transmission is prevented by them. What is the cause for the rigor after the death in the muscle? Question number 21. What is your answer? Punch your answer, doctor. Yes. Very easy question. Lot of you can answer. What do you say? C. Give another thought. C is ultimate consequence, but what leads to the C? Jyoti correctly answers that it is decrease in ATP level, which is the one which basically makes the rigor mortis. Phenoxybenzamine we use for lowering the BP, no? So what is the mechanism of action of this drug? Secondary messengers is a standard question in the entrance, doctor. You can't lose the vision of it. So what is your idea about secondary messengers? Question number 22. Who will give a confident answer? Phenoxybenzamin. Yes. Tarachand, Jyoti, Priya. Everyone is saying decreasing inositol triphosphate with calcium. Your classmates are reading very well. They are all answering confidently. See, the fundamental idea of any online class is, when your classmates are punching correct answers on the chat window, when we don't punch, time to introspect and speed up ourselves. So that should be the goal. I am very happy that a large number of you are correctly answering, because we are almost in the verge of finishing the third subject in a series of 19 subjects. By the time you finish the first 10 to 12 subjects, you must be brimming with confidence to face any entrance confidently. So the blood vessels with alpha 1 adrenergic receptors are present in the skin, the sphincters of GIT, kidney and the brain. And it is the inositol triphosphate is the one which is the secondary messenger. A 63-year-old businessman and is having a increase in renin, aldosterone and left renal vein renin. His right renal vein renin is decreased. So what is the most likely possibility? Gallbladder hypertension it is called as. Whenever there is any renal artery stenosis, typically there is an increase in the renin level. Question number 23, that's right. Priya, everyone is correctly answering. Vizag is also joining our online game. I am very happy. So, increased plasma renin activity causes a increased secretion of the aldosterone, is what we have to fundamentally remember. Now, this is an interesting question. Spirometry is one of the stark topics of physiology. 100% you need to be sure when you go for this particular topic. So, a person has a vital capacity of 5 liters, a tidal volume of 0.5 liters, 3.5 liters is inspiratory capacity. What is your answer? Expiratory reserve volume. Question number 24. So, you need to calculate few things. Expiratory reserve volume is equal to vital capacity minus inspiratory capacity. Inspiratory capacity includes tidal volume and inspiratory reserve volume. So first, what is the inspiratory capacity given here? 3.5 liters, right? So